Hi, I'm Dr. Adam Miller from Rise MD, here to tell you, in addition to the mask, hand washing, and social distancing, what you can do to help support your immune system. It's called the Immune Starter Kit, and it has 4 components to it. There's vitamin C, Olivirex, both of which are tablets. There's a Biocidin spray, and then there's a dropper with vitamin D. Now listen, these supplements or supports to your immune system do not supplant or replace getting 7 hours of good sleep every night, staying hydrated, exercising regularly, getting 150 minutes of exercise a week, and eating a rainbow of nutrient-rich foods. But the goal here is to help your immune system modulate or respond in a balanced fashion so that you avoid what some have called that cytokine storm, and you're also able to break down viruses should you get an infection. So vitamin C is a known antiviral. It is also a very powerful antioxidant that supports glutathione in your body. And there's studies out there showing that those with adequate vitamin C have a lower risk of getting infections like influenza. Our recommendation is that you start with 1 gram, that's 1,000 milligrams, twice a day. Vitamin C lasts in your blood for about 4 to 6 hours, so twice a day dosing is good. Now, if you start to feel sick, then we recommend you work up to 2 grams taken 3 times a day for a total of 6 grams. Why work up to it and not just start there? Because you can get a little bit of bloating and a little bit of gassiness as your GI tract adjusts to vitamin C. The second product is Olivirex. This is another capsule. Olive leaf is a well-established immune supporter that's been well documented by our friends in the Mediterranean region. It is a modulator. It helps the immune system from overreacting to viruses or other stimuli from the environment. And our recommendation here is that you take 1 capsule twice a day. We also, if you start to feel sick, we recommend that you increase that to 2 capsules 3 times a day. Should you take more olive oil? Sure. But this is a concentrated extract that's many-fold times more potent than olive oil. The third product is Biocidin spray. So as these two are working inside of you, the Biocidin spray is a topical in the back of your throat where the viruses like to set up shop and cause an infection. A study out of Louisiana showed that an hour after spraying the back of your throat with this formulation of 17 different herbs, secretory IgA, antibodies in the back of the throat, actually went up 60%. Right where the virus is trying to set up an infection, your antibodies are cranked up and you're more likely to fight that off. 1 spray twice a day for prevention, and if you start to feel sick, 2 sprays 3 times a day. Last is vitamin D. Now this is your dropper, and the reason that we've given you this particular vitamin D is that it's a well-vetted medical grade vitamin D, but it also includes vitamin K2. Why? Vitamin D helps your intestinal tract absorb calcium. And if vitamin K2 isn't present in adequate levels, then that calcium can start to plaque arteries. Instead, the vitamin K2 says, no. We want excess calcium to go into bone. So it's vitamin D3 plus K2 that you're taking. Each drop is 1,000 IUs. Vitamin D comes with an IUs. So we recommend for prevention that you start with 5,000 IUs per day. We also recommend that you get tested, get a blood draw, and make sure that your vitamin D is between 60 and 80. 5,000 IUs a day. If you're below 60, then increase that to 10,000 IUs a day until your second blood draw to document that you're in an adequate level, again, between 60 and 80. Now, if you start to feel sick, go ahead and add an additional 10,000 IUs. In this case, that would be 10 drops to your daily regimen. Those with low vitamin D have a greater risk of autoimmune disease. They're more likely to get infections. And 2 recent studies have shown that if you have deficiency in vitamin D, that is a level lower than 30, and you get COVID-19, you have a much worse outcome. This is your immune starter kit. There are advanced kits if you want more information about that, or you just have questions about this kit, please email info@AriseMD. I'm Dr. Adam Miller reminding you that the best is yet to come.